Well, it's called Kids Count. It's a report that ranks children's well-being in each state. Comes out every year. The new report is out today, and joining us this morning is Eric Griego, the Executive Director for New Mexico Voices for Children. Eric, thanks so much for being with us today.
Thanks for having me.
First of all, before we get into how New Mexico did, and it's better this year, tell us a little bit about how accurate this report is and where that information comes from.
Well, this is an annual report that the Annie Casey Foundation puts out. This is the 20th year they've put it out. It's based on census data, the American Community Survey primarily. So it's considered the most credible source of information on child well-being data in the country.
And we're still not gangbusters in New Mexico, but it is an improvement for 2007.
Yeah, you know, New Mexico typically, sadly, brings up the rear in terms of being one of the bottom 3 states. This year we went from 48th last year overall in these 10 indicators to 43rd, which is good news, primarily driven by a really big improvements in infant mortality. We're actually in the top 20 in terms of doing well and the low number of infants who die.
Now that surprises me a little bit based on how poor the state is in some parts.
I think it surprised a lot of us. We're trying to get to sort of the bottom of that. We think it's some improvements in prenatal care, some improvements in health care, some investments the state has made in making sure that we have Medicaid for struggling families and so on. So
I know there's another improvement in the reduction in the high school dropout rate.
Yes. You know, they track it a little differently than we track it, so some folks were a little surprised by that number. This tries to compare a measure that each state does. It's a little more comparable. So I think it does bode well in terms of saying that we've done a little bit better, but I think I'm sure there'll be some folks who disagree with that number.
Right, from 16% to 8% there. Now, areas of concern for you, is there something that we need to improve on?
Yeah, you know, the biggest disappointment we think was the teen pregnancy rate. We're the next to last, now 49th, which I think is a real serious issue that we have to think of some ways to affect that. And then the pervasive measure, as you mentioned, that we always seem to have a hard time getting out of the bottom 5 is child poverty. And I think that affects everything else. Really, poverty is so strongly correlated with all of these other negative outcomes for kids. So we really have to think about how we keep investing in kids. Even in this recession, the answer isn't, you know, cut back on kids programs. In fact, this is the very time we have to really keep those supports in place.
And you're right. I mean, and these numbers are for 2007. Is that correct?
Right.
And so they don't really reflect what's going on during this recession. And I know you're trying to hang on and keep kids' health, you know, well-being in a positive way.
Yeah, I think the message of anything in this report is that now is not the time to say, you know, cut back on anything that affects kids, because this data really is 2006, 2007 data. It doesn't reflect what we think, unfortunately, maybe even some more negative developments during the recession. We got to invest in kids and families. Now is the time in a tough economy. So.
Are we talking money? Is it, when you say invest, is it mostly money you're dealing with?
I think it is. I think we need to make sure that all kids have health care. We need to really take our early childhood investment. There's strong evidence that if we invest in those early 4 years, that all of these indicators will be better in the long run. And we really have to just think about, you know, how do we improve our school system but not divest in our school system. You know, education, health care, programs for kids, early childhood, those shouldn't be the places that we try to balance our budget. So,
Eric Griego, thanks so much for getting up early with us this morning.
Thank you so much for having us.
Appreciate it. All right.
Appreciate it.